Today, we're going to talk about how the baby navigates the pelvis. Your baby will have sutures on their head. They are soft spots that allow the baby's head to be flexible and mobile as it moves through the birth canal if necessary. One of my favorite things about cervical exams is that you can usually tell what position the baby is in by feeling for the suture in an exam. So when the baby starts to engage in the pelvis, they engage by turning to their side and they slowly move their head into the pelvis. When the baby is engaged, a care provider can insert their finger with a cervical exam, move past the cervix, and they can feel for the sutures on the baby's head. Then they can tell if the baby is facing one way or another. The suture on the front is a diamond, and the suture on the back is a triangle, and that is how they tell. Baby's position can be identified through palpation as well, so cervical exams are not always necessary to identify fetal position. But if you did want a cervical exam, I would ask, how engaged is the baby, what position are they in, and are they well applied to the cervix? This is helpful information to know because position really is everything. If the baby is coming through the pelvis, stuck a little to one side or a little to the other side, this will inform you of what positions for you as the birthing person to assume to support your baby into getting in a better position. If your baby is coming down more on the right side, it may be ideal to do some positions like side lying release or exaggerated side lying on your left side. Anything you do on one side, it's good to do on the other side. But if you're trying to correct baby's position, it may be ideal to stay on the side that you're trying to encourage baby to move to a little bit longer than the other side. There are certain positions that create more space in the pelvis, and when we create more space, it allows baby to wiggle into the spot that they're supposed to be. Babies go through a series of movements called the 7 cardinal movements of labor. It's really quite miraculous that they know exactly what to do and how to move through the pelvis. All we need to do is give them the space to do that. Moving frequently throughout labor, changing positions often, and performing spinning babies positions in pregnancy will all help to support the flexibility in the musculature that surrounds the pelvis to allow space for the baby to move through. Now let's go over the 7 cardinal movements of labor. The first is engagement. This is where the baby starts to engage into the pelvis. This is also known as dropping. You may hear that your baby drops. This may be a sign that labor is nearing, but sometimes babies engage in the pelvis many weeks before labor starts. So it doesn't always mean that labor is about to start soon. But it is a sign that your baby is getting ready. When the baby drops, you may feel more pressure in your pelvic floor, in your pelvis. You may feel like you need to pee more often. It may be harder to walk without waddling. After your baby engages in the pelvis, they descend, meaning they move deeper into the pelvis. After they descend, they go through a process called flexion. This is where they tuck their chin to their chest. When babies tuck their chin to their chest, it allows for the diameter of their head to be smaller and it makes it easier for them to move through the next part of the pelvis. The next is internal rotation. So baby has tucked their chin to their chest and now they go through a process of internal rotation where they move from looking to the side to looking straight back behind them. This is called an anterior position. Anterior position is where the back of the baby's head is facing the front and the face is pointing towards your back. So they come through like this and they come out like this. A posterior position is when baby is facing forward with their face pointing towards your front and the back of their head pointing towards your back, and they would come out like this. In an anterior position, which is most common, the baby will engage in the pelvis looking to the side and they'll move their head straight back. There are other circumstances during the internal rotation where the baby will be looking to one side and rather than just moving their head straight back for the internal rotation, they may instead move their whole body around to face the back. Sometimes babies will go to move all the way around and they'll stop at the front, in which case they will be born posterior. This is rare, but it does happen. So after baby goes through the internal rotation where they move to face the back, Then they begin to descend and they come out of the birth canal and they lift their head up, and this is called extension. After the baby extends their head outside of the birth canal, they need to then decide which shoulder is going to be delivered first. Both shoulders can't come out of the pelvis at the same time. If you see trying to bring the baby out straight like this, the shoulders are getting stuck on those front bones. So instead, the baby decides which shoulder is going to be delivered first through a process called restitution. This is also known as external rotation. So during restitution, the baby will turn to one side, and when they turn, the shoulders follow. And so this will allow for them to deliver one shoulder at a time. The top shoulder will be underneath the pubic bone, and this is the shoulder that is delivered first. This is why care providers sometimes will apply gentle downward traction on the baby's head, pushing downward to encourage the top shoulder to clear from the pubic bone. Afterwards, a care provider will usually lift up to encourage the bottom shoulder to come out of the pelvis that way. But most of the time in a hands-off delivery, the baby will naturally deliver one shoulder and then the other all on their own without any external support. In very rare circumstances, shoulders can get stuck. This is known as shoulder dystocia, in which case a care provider will be able to resolve a shoulder dystocia by reaching their hands inside of the birth canal and manually rotating the shoulders to help them clear the pelvis. So we're going to go through that again. Engagement, descent, flexion, internal rotation, extension, external rotation, and the last is expulsion, when the baby clears the birth canal. Yay! So what's the difference between an OP baby and an OA baby? OP, or occiput posterior, means the baby is facing forward, and OP, or occiput anterior, means the baby is facing backward. After baby completes the internal rotation and they're facing backward, it is a little easier for most babies to navigate the pelvis when they're facing your spine. This is because of the way the head is shaped and the way the pelvis is shaped. When the baby is facing back, they're able to clear past the tailbone pretty easily. When the baby is facing forward, there is more space protruding on the back of the baby's head than there is compared to the front of the baby's head. This back space can have sometimes a bit of a tricky time navigating the tailbone, which can sometimes cause back discomfort or pain in labor, or it could make labor last a little longer in comparison to an anterior baby. Posterior births are more rare, but they do happen sometimes. And really the best way to support a baby who is posterior is to move frequently throughout labor. Even with an epidural, you can switch from exaggerated side-lying positions, and you could even potentially get into a modified hands and knees position with support of pillows and props. If you have an unmedicated birth, you'll be able to switch positions often and move intuitively. Doing lunges and squatting are a great way to increase space in the mid-pelvis where the baby is completing the internal rotation and support them in navigating that part of the pelvis, hopefully without too much discomfort in your back. Just to give you an example, see how the back of the head needs a little more support and work kind of getting past that tailbone. I recommend looking at the Spinning Babies module to get some instruction on things that you can do to support your baby in getting in an ideal position for birth prenatally.